you. So a little bit more background on me. As Erin mentioned, I'm with our Shelter Medicine Services department, and so I am not with FIR like the rest of the speakers today, but so essentially we offer shelter medicine support to the rest of the teams within the ASPCA. So if anyone has any really FIR-specific questions, I may defer to somebody else, one of the other speakers up here, so just kind of giving that warning. But just a little bit more background about me, because since I'm not with FIR, I haven't deployed with that team, but I do have a little bit of background from a disaster response standpoint. So as Erin mentioned, my previous position, I worked in a private shelter, Larimer Humane Society in Colorado, and our shelter served as the primary response organization for companion animals in a disaster situation. And while I was at Larimer Humane Society, we actually did deal with fires and floods. So I do have a bit of experience there, kind of responding to disasters from a shelter standpoint. So I'll probably bring in a couple of those examples as we're going through the talk today. But as you can tell from the title, we're gonna focus on the veterinary medical aspect of response in emergency shelters. And if you guys have any questions as we're going along, please feel free to ask. So I want to talk a little bit about planning, and again, that's mainly from the medical standpoint. Some of that's going to be a little bit of overlap from what Dick just commented on. Then obviously we'll spend a lot of time talking about the medical care piece in the shelters, and then just a little bit of safety, again, as it relates to the medical piece. So when it comes to planning, I think, that sometimes when people hear disasters and planning, it might sound counterintuitive, but hopefully, as you got from the last presentation, it's not. Sometimes you actually do have a little bit of time to plan. Sometimes we don't. I think the example Dick used with an earthquake, sometimes, it happens and we have to respond. But other times you can see, like the storm that we have brewing down in the Gulf, you can see what's happening. You can start to plan and start to think about what you might need to do. So what you want to do when you think about planning is really coordinate. So coordinate with the other teams. Again, as was already mentioned, there are a lot of different teams that work together. So for the medical piece, you would start as early and do it as often as possible. Work with your sheltering team, logistics teams, figure out what you're going to need, how many people you're going to need, what kind of supplies, that kind of thing. And essentially the way to think of it is, the more prepared you are, the better able you're going to be to deal with those unexpected things that pop up. So even if you think about it from just, for those of you, that work in a shelter or maybe work in or have worked in a vet clinic, vet hospital type setting, think about, practicing CPR. You don't know when you're going to need to use it, but you want to be prepared to use it so that if you have an animal arrest, you're prepared, you're ready to go, and then you can deal with that emergency as it comes up. And then if there are any little, twists and turns, as there often are in those situations, you're better prepared to deal with them because you already have the basics in place and you know what to do. So when thinking about planning for a disaster, one of the things you do need to think about is licensing. And this primarily relates to veterinarians, but also to technicians. And for those of you that don't know, in the US, veterinarians are licensed in each individual state. So there's not what we call like a national portability. So I'm licensed in Colorado. I can't come here to New York and just start practicing veterinary medicine. And so obviously you can see how that could be a problem during a disaster because you may not know, where you need to go. So you need to know what, who is licensed where, your professionals that you have coming to work at the disaster, who is licensed. And also think about, okay, if you have responders that come that are not licensed, what can they do? What are the laws? They may not be able to directly practice veterinary medicine, but can they work under a licensed veterinarian and still, be part of the team and help with the medical care? Technicians are a little bit different. Not every state has licensing requirements for veterinary technicians, so that's something that you would just need to know ahead of time and work through and figure out, again, who is licensed, who's not licensed, what can they do, what can't they do. And then the other thing to think about is that sometimes during disasters, the temporary licensing is expedited, so meaning that I'm going somewhere that there's a disaster, so I'm going down to Louisiana, I'm not licensed there, but because there's a disaster, they may figure out a way to expedite the licensing process so that I can practice veterinary medicine. And just so you know, there is some work going on nationally to try and change that, to make it a lot easier. I think all of us that, in this room probably understand why that would be such a great thing to just be able to have, essentially one national license and be able to practice. But unfortunately, right now, it's not that way. Also, with licensing, you need to think about controlled substances, so DEA license. So somebody has to have a DEA license. So when you're responding to these disasters, you need to be thinking about what drugs are you going to have? Are you going to have a need for controlled substances? And the answer is probably most likely yes. Those medications are used for pain control, sometimes used for sedation, and then obviously for euthanasia as well. So it's just one more thing to kind of think about, plan ahead as much as possible, and make sure that that is in place. And then, excuse me, understanding the laws of your community. So a big one to be aware of is what is the stray hold period in that area, and does that change during the time of a disaster? So it's possible that the area may have normally a 3-day stray hold, but during a disaster that's extended even further because they want to give individuals an opportunity to reclaim those animals, because obviously that's our ultimate goal, is to get any displaced animals back to their owners. So understanding what that hold is important when you're thinking about sheltering. And then just understanding or thinking about rabies quarantine as well. And with this, I'm referring to bites. So if an animal bites a human, typically it's a 10-day quarantine. You have to keep that animal, but make sure to check local jurisdictions to see if there are any other, added restrictions that might be in place. And then that may also affect you when you can vaccinate animals as well. And then from a medical standpoint, you definitely need to think about what types of injuries you might deal with depending on what kind of disaster. So you're going to see different types of injuries depending on, are you dealing with a flood? Are you dealing with a tornado, a volcano, a fire? You're going to see different types of injuries. So again, as you're preparing, obviously once the disaster happens, you can start to think about what you might need to prepare for, what kind of injuries you're going to see. And I have a couple pictures. I'll let you know. A couple of the pictures coming up are a little graphic, so just to kind of give you a heads up of some of the pictures that are coming. But for example, flood injuries. So if you have animals that have been trapped in floodwaters, they could just have injuries from debris that's floating by. They have abrasions or punctures, things like that. Dr. Broadus, who shared some of these pictures with me, she's at Austin Humane in Texas, and she said they actually saw a lot of neck injuries in one of the floods they dealt with because animals were left tied out, and when the waters rose, the ones that unfortunately did not drown were kind of swung around on the end of that chain, and they saw a lot of neck injuries. And I thought that was interesting because that's not one I ever really would have thought of, but obviously anything can happen during disasters. Fires, obviously I think that is pretty self-explanatory. You get these animals, they get close to the flames, you're going to see burns. So on this cat, obviously I think it's pretty clear. You're seeing, he's got the burns on the ears, he's got kind of some scabs down here under the nose, around the mouth. Those are pretty obvious ones. This is another dog that Dr. Broadus dealt with, and this was also fire. So, at first glance, this dog really, it doesn't look too bad overall. You can see obviously some of the main injuries back here around this leg. The leg's really swollen. You can see some bruising, some what look like superficial burns. But what we can see a lot with fires is more what we call the thermal burns. And for anyone that hasn't dealt with them, these can be, they're pretty nasty. And this next picture is probably the most graphic one I have. But what happens with thermal burns is that they're not apparent right away. So again, you can see the injuries that are on this guy, but a couple weeks later, or over the next couple weeks, his skin started sloughing till he looked like that. And that is because of burns. So essentially the fire he was close enough to the fire that it caused burns on the skin, but he wasn't up next to it, so it didn't burn the fur. So these are kind of burns to the skin. And fortunately, this guy made a full recovery, but this required months of wound care to help heal those burns. So again, just things to think about. You're going to deal with all kinds of different injuries depending on what kind of disaster you're dealing with. And then also for that planning piece, obviously you just need to think about the animals and what you're going to be dealing with. So how many? Do you have an idea of how many you might be dealing with? And then thinking about the housing. And I'm not going to talk about this too much because Joe's going to go into that in the next lecture. But when you're preparing for the animals, particularly from a medical standpoint, think about you're probably going to need areas for isolation if there are any infectious disease. You're probably going to have pregnant animals, so you're going to want to separate those guys out from the rest of the general population if possible. And then you are likely going to have animals that have some critical needs, so you're going to have a space where you can monitor them more closely. And then just thinking about the type of housing. Again, is it individual housing? Are you going to do any group housing? You're probably going to have some dangerous animals or potentially dangerous animals. How are you going to house them to keep your responders safe? And then are you going to need any areas or do you have areas that you can use, kind of as an exercise area, time out of kennel, or even extra in-kennel enrichment? So that was a little bit about planning. Any questions from the planning standpoint before we kind of get into the more nitty-gritty of the medical care? Okay. So when we're talking about medical care in the shelter, if you could, I guess, put together a shelter clinic wish list, you realizing that you may not get everything that you want, or it may not be exactly what you want. Sometimes you gotta work with what you have, but ideally, kind of your clinic area in this shelter, you'd have an area for examining and treating the animals. Realizing that a lot of times your cage side exam, and sometimes even treatment is pretty common, sometimes even easier than taking the animal out of the kennel, bringing it to a treatment area, and taking it back to the kennel. A lot of times it's easier for staff, it's easier on the animal to do stuff cage side. Having an area for pharmacy, so where you're going to keep all those various medications, drugs, and other supplies that you're using, and an area just to prep all that treatment. And realize, that pharmacy might need to be mobile. If you need to go out into the field, initially when you're doing triage, which we'll get into a little bit. So you may need to be able to take all of those supplies with you. Needing refrigeration for any vaccines that you have and some of the medications. Again, realizing that might need to be mobile for a short period of time, so potentially having small coolers that you can take and carry out into the field. And then also just an area for managing all those records, all that information that you have coming in that we need to keep track of. Having some kind of space to do that is ideal if possible. And then thinking about critical care. So I think that the biggest question when thinking about this is how much and kind of what level of care are we able to provide on site? What are we going to be able to do there? And again, that's probably going to vary between situations depending on what you're dealing with, what kind of injuries you have. And if you can't deal with it on site, do you have the ability to set up any kind of off-site care at, at other clinics, other veterinary hospitals? So with that, you really need to think about what's in the area. What is it possible to even get to those other clinics? Are those clinics, again, depending on what's going on, are those clinics functional? So there's obviously that's going to vary quite a bit, but finding out that kind of information and thinking about that ahead of time as much as possible is very helpful. So the medical teams that you're going to have when you're working with in these emergency situations. So you're going to have a field triage team, and Dick alluded to that a little bit in his earlier presentation. So that's just like it sounds. Those are the medical team, the veterinarians and staff out in the field making decisions prior to that animal arriving at the shelter. And then intake teams, and this, again, sounds like depending on the situation may or may not happen in the field as well, but the intake team, they're going to be doing that initial assessment, getting vaccines and deworming on board. And then you're going to have ongoing care. So that's just like it sounds. Any animals that need additional medications, need additional care for injuries that are ongoing, need to be revaccinated, that kind of thing. So obviously you can see there's probably going to be overlap between some of these teams. They're not necessarily static that, if you're assigned a field triage, that's all you do. Obviously when that's done, you may come back and pick up some of that ongoing care. So with field triage, if you're not familiar with that concept, essentially it's just going in and classifying the animals. So what you're going to do, so primary thing, you get out in the field and you're looking at these animals, you're going to put them into essentially one of three classifications. Either the animal is already dead, or they're so far gone that with the care that you can provide, they're not going to make it. So for those animals, typically humane euthanasia is the best option. Another subset would be that these animals are great, they're fine, they're probably going to make it no matter what you do or don't do. And then you have kind of that middle of the road that these animals, they have some injuries, but they're likely to survive with the care that you can provide at that time. And I think the biggest thing to remember is that all of the animals, regardless of which of those classifications they fall in, they're going to receive some kind of comfort care. And by that I mean we're going to make sure they're comfortable. And that may be with, like I said, in that first group that we're making the decision to euthanize because their injuries are so grave. But we are making sure that all the animals are receiving that care. So then medical intake. So the primary goal with intake is really just to process these animals, and I'll go through the different steps there. But bring them in, process them, make sure they're comfortable. And then the secondary goal is then going to be to identify what issues they have that either need to be addressed immediately or need follow-up. So that intake process, what that looks like, pretty similar to what you'd think of in kind of a typical shelter intake. So you're bringing the animal in, you're going to obviously scan them for a microchip, vaccinate them for kind of your typical shelter vaccine protocols. And it's easiest for, in this type of setting, if you can have those protocols posted so that people can just glance at them quickly, they know what they need to do, and then can give the appropriate vaccinations. Because remember, again, you're probably going to be dealing with some responders who, are coming from different backgrounds, may have different thoughts about what needs to be done, what doesn't need to be done. So if you have you want those protocols developed ahead of time, you can post them and say, here's what it is, these are the vaccinations we're doing. Same with deworming, have your protocols spelled out, have a dose table so it's easy to look at, people can do it at quick glance and just give the medications they need to give. And understanding that, letting people know, they're probably going to need to estimate weights and ages, if they don't have a scale immediately nearby, they might need to estimate weight. Ages, there's some great aging charts that you can also post in the intake area so that individuals can feel better about estimating ages of whether it's puppies or kittens or older animals. And then also with the intake process too, you're going to identify if there are any major medical issues that need to be addressed. So, looking for signs of, infectious disease, or are there, major wounds that are present that need to be dealt with immediately, Or are there issues that, okay, they don't need to be addressed right now on intake, but we need to make sure the animal's comfortable, but we can come back and we can reassess, later that day or the next day, depending on timing. And then also, too, I just want to kind of throw a reminder that making sure if the animal doesn't already have some kind of identification on it, that it gets identification for multiple reasons. Obviously, we need to know which animals we're dealing with so that when we do we can create records for them, we can make sure all treatments are recorded, and then if there is follow-up, if we need to revaccinate, we need to start them on medication, we need to follow up on just care that they're going through, that we know which animal's which. And then obviously, too, if that animal is to be reunited with its owner, that identification can make that much more easy. And I commented on records. So obviously, I think you guys all know how important it is to maintain records on animals, any kind of care that we're doing for them, and remembering that it is a legal document. So you need to make sure that you're recording all the treatments, any exam findings on these animals. And you need to make sure that they're as complete as possible, but they're legible too. And I'm sure a lot of you have dealt with records that are not so legible. So I think it's always easy to, if you can avoid a lot of handwritten records, it helps. But in these situations, that's not always possible. So what you can do to help alleviate or help, I should say, decrease some of the amount of writing that's required is to have kind of pre-printed exam forms. So use a template where people can maybe check boxes or only have to write a small amount if they have to write about abnormalities. I mean, it just makes it a lot easier. Again, I'm sure all of you have tried to decipher records in somebody's handwriting and you have no idea what they're trying to say. So using kind of those pre-made templates can make that a lot easier. And then it also does help to make sure that you're getting that you're accomplishing everything that you need to. So again, say you're doing a physical exam on an animal, if you have individuals from different backgrounds that are coming, that are responding to these situations, everyone has a little bit different way of doing something. So if you have that form, that way people just go through it, they make sure they're hitting everything that they need to and that they're not leaving anything out. I touched on, kind of the digital versus paper, and sometimes that's just, you do what you can do in this situation. And then another thing to think about is, are these going to be cage-side records, meaning are these records going to be on the individual animals' cages, or do you have a centralized location where you're keeping these records that you access as needed? And again, kind of, might depend on the situation and what's easiest. What works best. It may be a combination of both. Maybe you have cage-side treatment records for ongoing treatment at the time, and then that is filed with the full record. And again, as I mentioned earlier, I think just those records obviously allow for continuity of care. And so by that, I mean that you know what's been done, you know what needs to be done in the future, and that once that animal leaves your shelter, you can pass that information on to someone else so they have a record of everything that's been done. And I started to touch on this, but having medical protocols is essential. So creating detailed protocols so everyone knows what they need to be doing and how it should be done. And it just makes everything easier for everyone. Again, like I mentioned, you tend to have people, different responders coming in. Everyone kind of has their own idea of how they usually do things and how they want it done. And I'm sure you can imagine how frustrating that can get to the rest of staff and responders that are dealing with these cases. If you have one veterinarian that's treating the URI with this medication, well, and this veterinarian's treating it with a different medication for a different length of time, and just trying to keep all that straight can get really confusing. So for those basic or those routine issues that you're seeing, having detailed protocols of, okay, here's our vaccination protocol, here's how we're going to deworm, here's how we deal with a routine URI, here's how we deal with skin infections. So having that so that all responders can follow that really makes it easy. And just even standardizing things like your treatment length, and making sure people specify recheck times. I'm sure you guys have seen records before that's, recheck in 3 to 5 days, and what does that mean? And then who's responsible? And are you checking on day 3 or are you checking on day 5? And what ends up happening is the animal never gets rechecked, and it's 14 days later, and you realize, oh shoot, what happened? Why isn't this guy doing any better? So that just helps to streamline things, keeps everybody on the same page. And those protocols really need to be easily accessible. So if you can have the, pre-printed, something that's really easy, that works really well, is just to pre-print protocols, put them in a binder, and have the same binder in multiple locations. So that might be, in intake in your pharmacy area, maybe treatment area, kind of depending on how the shelter's set up. But having those protocols available so that they're easily accessible and anyone can reference them when they need to. And forms, again, I had also touched on this a little bit, but having pre-printed forms, and that can be from anything from like your intake exam to treatment for a routine condition or routine disease that you're seeing, so that, again, you're cutting down on how many handwritten notes you have, but again, it also makes sure that you capture everything so that everyone, you're not missing anything, you're not leaving it out, and all the necessary information is there. And it's also a good idea to have flow sheets for specific situations. For example, if what happens if an animal bites or scratches a person, or say we do have an agreement, we can send an animal off-site somewhere to another clinic. What process, what steps do we need to go through? So having those, again, essentially it's a protocol, but it's just a nice little flow sheet that someone can refer to, so that when those situations arise, everybody knows what steps they need to take and what they need to do. And then making sure that if you do have any critical care cases or just ongoing medical cases, that you have a way to keep track of those. So obviously, the main thing that you're trying to do is make sure that those animals get the care that they need. But again, you guys know when you start dealing with dozens to hundreds of animals, obviously that can very quickly become overwhelming if you have a number of animals that you need to follow up on. So this can be done in a number of ways. It can be something as simple as a whiteboard like this, where you just keep a list of which animals have ongoing care. Maybe if you are using, shelter type software or some other kind of computer database, you can generate a list that lets you know what animals need treatment, when do they need treatment, but just make sure there is something in place so that you can follow up and that those animals do get those rechecks that they need. And then also to just making sure that there's a way for non-medical staff to communicate with your medical team about what if there are medical concerns in the animals. And as you guys know, typically those your animal care staff that are in there day in and day out, often multiple times a day, caring for those animals, they are really good about picking up on things that you may not see, when you're just looking at that animal every 3 to 5 days. So having again something as simple as a whiteboard like this, where the staff can write down, who the animal is and what the concern is, when they saw it, and then that way you can have a medical team member that's assigned to checking that board, at a set frequency, so that they can then go back and follow up and determine, okay, is this something that needs further treatment? Do we need to examine this animal some more? And this way, again, anybody that's worked in shelters knows this is often how you can pick up on, signs of, particularly in signs of infectious disease very quickly and really stay on top of things. And then also from a medical standpoint, thinking about what diagnostics that you might do in shelter, and what do you need to do? So first of all, thinking about, what would you do in-house? What would you do in shelter? And a couple of things to think about when deciding, okay, do we do this in-house? Do we send it out? Do we need to do it? are thinking about how much time does it take to run whatever this diagnostic test is we're talking about, and do our staff or responders have that time to run it, or how much time is that going to take away from them doing something else? And then also thinking about the skill of the responders that you have. You know, how intricate, if you will, is this test? You know, how many steps does it take to get it done? Is it something that's fairly simple, or is it something that is, you know, very exact, and if we don't do each step as, you know, if we don't follow the directions exactly, we're not going to get the results we need. Because, you know, it's great if somebody can run a test, but if they don't do it appropriately, you're not going to get reliable results. And then, you know, ultimately, it's not worth the time or money that was put into that test. And then just thinking about what resources might be required to either store or run those tests. You know, so do you need electricity? You know, for example, do you need electricity to run a refrigerator to keep those tests cold before you run them? And then also, too, do you absolutely need a definitive diagnosis in this case? And how quickly do you need that? So, you know, I think parvo is a good example. I think, you know, if we're suspicious of parvo, we want to know if it's parvo, and we want to know pretty soon so that we can isolate that animal and we can you know, mitigate any potential spread. You know, so that's one you might think, okay, yeah, and it's a pretty simple test to run, so I think we can do that in-house if we need to. And then, you know, thinking about, so if it's something you can't do on site, is it something you can send off? Is that even possible? Again, you know, is there somewhere in the local area where you can send that test? And again, depending on what kind of situation you're dealing with, that may not be the case. That may not even be an option. But, you know, if it is, and thinking about, okay, well, how are we going to get it there? Can we transport it? Do we have someone that can take it there? Do we have someone that has the time to do that? And, you know, ultimately, are the answers that we're going to get from that test, are they worthwhile, and are they going to help us in our care of this animal and the population in general? And then just thinking about your pharmacy a little bit. So obviously you're going to need medications, vaccinations, but you really want to kind of streamline these based on those protocols that you came up with. So keep it to a minimum based on what you need. Obviously there's a lot of antibiotics out there, but you're not going to go and stock every single one of those antibiotics because you're probably going to use a very small percentage of them. So just keep what you need, use those, follow the written protocols you have. And if there are those, you know, kind of off cases where you do need something that you don't have in stock, it may not be worth it to go get it for one animal, but perhaps, again, depending on what's going on, perhaps you can write a script and get it from, you know, a local pharmacy. Excuse me. And then along the lines of medications, just think about preparing daily medications. So who is responsible for that in your shelter? You know, who's going to be responsible for both preparing them and then administering them? So the system that FUR uses, and this might be pretty similar to what some of you use, you know, in a typical sheltering situation, but is using the little, I call them little French fry boats, because that's what they look like to me, but those little paper boats. And then each of them gets a label with, you know, the animal's ID, their kennel number, and then the medication name and dose. And to make sure it's correct, to try to eliminate errors, those prescriptions are filled by one person, and then a second person comes along and verifies that. So you have two sets of eyes on every medication. So, and like I said, hopefully you're eliminating any errors there. And it really does help kind of streamline the process. And it does also, the added benefit, particularly in this situation, is that it enables non-medical professionals to prepare and administer the medications. And then I think also too, another benefit of doing the medications this way is that it does allow the medical responders to kind of go out into the shelter and really interact with the animals a little bit more. Because as you guys know, anybody that works kind of in the medical area, in the vet clinic piece, sometimes you kind of get stuck in that area and you really don't get out much. You know, you get to, the animals might be brought to you, or like I said, maybe you are doing some cage side exams, but you're probably just going, you're checking that animal that's on your list and you're moving on to the next animal. So, you know, when individuals are going out and giving the meds, obviously they're not medicating every animal in the shelter, but they are getting that chance to just, you know, just walk through the shelter and kind of see the animals that are out there. And I think it's, while it's not a formal, you know, kind of rounds to take a look at every animal, as your responders are walking through giving out those medications, it's another opportunity for them to just have eyes on all the animals. And sometimes you can pick up on, you know, clinical signs of something, and you realize, hey, that, you know, that skin doesn't look so great. It's really not clearing up, or, you know, this cat still has nasal discharge. He's not due for a recheck for 2 days, but he's not looking great. And so you can pick up on some of those clinical signs a little bit earlier, and hopefully get those animals, you know, in for a recheck sooner and move the process along. So any questions kind of around the medical piece? Yeah, and you can, don't forget to use the speak.
Not on,
oh,
because there's some
okay, never mind. All right. All right, if people can't hear, I'll just repeat the question.
when you're talking about setting, you know, the protocols and having these supplies, is that applicable to your kind of field setup, or are you talking about the shelter environment itself?
Yeah, so the question was around having the protocols, is that applicable to the field environment or to the shelter? And I would say to both, yeah, to both, as much as you can. I think, again, obviously realizing, you know, when you're talking about disaster response, you have to be fluid, you have to be willing to change, but having those as much in place as you can ahead of time is helpful. Yes?
A little hot button topic for those of us that have DEAs. Can you go specifically into how you're handling the DEAs with first response, since you're not supposed to be taking them out of the area where they're issued to? What's the mechanics of how you guys do it?
So the question is around DEA license specifics, controlled substances and taking them out.
Technically, they're not supposed to be moved from the area where they're shipped to, but clearly that's not happening. So let's say, first of all, who is the DEA veterinarian who's responsible for the drugs in, let's say, a particular incident? How does that work?
So, and this one I may have to kick to somebody else, Joe, maybe, because like I said, I have not deployed with fur, but do you feel comfortable answering?
It depends a lot based on the disaster. Speaking towards disaster response specifically, we'll usually try to find a local vet who has a DEA license in that area who is willing to either come on as a paid consultant or a volunteer to help out and be the holder of that DEA license. We also have to do that if we're setting up shop in different states for our cruelty cases, just based on, currently we don't have any vets on the fur team. One of our vets that we did have was licensed in 12 states and had DEA licenses in a couple of different locations for shelters that we had for long term, but we're usually looking for a local veterinarian with a DEA license who can come out and help.
Does that answer your question?
And they'll
Sorry.
usually come and go with those meds.
Yes, that was
They
the next
don't,
question.
they don't
Oh, okay.
leave them, they'll bring them with
Bring
them
them.
each day as they come in.
Okay.
All right. Thank you, Joe. Any other questions around kind of the medical piece before we move on? Oh, yes.
So I don't really know much about the DEA thing. Do all vets have that license since they give out medication? Or
No, so question was, she said didn't have a lot of knowledge around the DEA license. So no, a DEA license is only for controlled substances. So think of, you know, like morphine, ketamine, euthanasia solution. Not all, the majority of medications do not require DEA or Drug Enforcement Agency, do not require that DEA license to prescribe.
but veterinarians usually do euthanasia since they
Right. So our question is, you're asking, okay, veterinarians usually do euthanasia, and that can vary between, like, if you're in, particularly think of like a, you know, even a shelter setting is, not the best example because it's not always a veterinarian, but a shelter can get a limited license to have the euthanasia solution at the shelter, or say like in a private practice. Sometimes it's a practice owner that has the license, and then the euthanasia solution is used within clinic under that person's license. Yeah, absolutely.
So if you're in a disaster situation like that, and you have several different organizations responding, who is the one that gets to decide on that medical protocol? Or, like vaccine, because you're going to have multiple veterinarians and everyone's going to want to do things differently. So who's the final say on that?
Right. So the question was essentially if you have multiple organizations responding, who's the final say on those protocols? And I think that's where it goes back to understanding who is the lead agency and essentially who's in charge. And then they set those protocols. So that's where I was saying, particularly for fur, setting that protocol, because just like you say, a lot of responders coming in from all different areas, have different opinions on what is right and what is not right. So having that protocol. So that's where, it definitely comes down to saying who's in charge. Yeah. Yeah.
Just the other one, which ASPCA may or may not be recommending. Are you guys in your sheltering situations now in disasters using the canine influenza vaccine or not as part of your vaccine protocols?
So the question was, is ASPCA using the canine influenza vaccine in disaster protocols? To my knowledge, no. Right? Okay. Yeah. Okay, so we'll move on. I just have a little bit kind of lumped into safety. Again, a lot of it has to safety in relation to medical related issues. Obviously safety, you could probably do a whole lecture on that in and of itself. But when we're thinking about sheltering in, during disaster type situations, we need to think about the behavior of those animals. And obviously we need to think about that all the time. But particularly when we're in, disaster type situations, these animals are probably even more stressed than normal. So has anyone here themselves been involved? I know there was somebody that was, lived where the earthquake just happened. I mean, anyone else ever had to have been evacuated because of disasters? A couple people. So you guys really, and I personally never have, but I can only imagine how stressful that is. So now imagine, and you guys, you at least had some understanding of why, of what was going on. So now think of that, if you can, from an animal standpoint. Obviously they have no idea why. Their world's just been turned upside down. They've been put into a new environment. They're probably separated from their people. They don't have their normal routine. They may have suffered some physical trauma themselves. So I think it's fair to say that you should expect some behavioral issues to either to be present or potentially develop while that animal's with you. So when thinking about the options we have to deal with that, I think we have essentially two kind of big arms. So we have non-pharmaceutical options and pharmaceutical options. So when you're thinking of non-pharmaceutical interventions, think about things like using experienced handlers. As you guys probably know, the way an animal is handled can make a world of difference. So you want to make sure that you have individuals that know how to handle animals. And if you do identify animals that seem particularly stressed or are potentially dangerous, maybe you need to limit handling to your very experienced handlers that know what they're doing, so that they can decrease stress in that animal and also so that they're not putting themselves at undue risk. Sometimes it's something as simple as moving the animal to a different spot in the shelter. I'm sure you guys have all seen this, again, particularly cats. Sometimes you just, if you can, move them to a higher kennel or give them a little box to hide in, and they do great. And that kind of also goes along with the next point, just some visual barriers too often can make a huge difference. And making sure they have some kind of enrichment in their kennel so that they have some outlet. And then, so the other arm would be using some psychoactive medications in the short term to help with that stress. And this is something, I don't think necessarily every animal needs to be put on medication, but in this type of situation, it is definitely not wrong to reach for a medication that is going to help reduce the anxiety in that animal. Might sedate them a little bit, might not. I mean, that's not what we're talking about. I'm not saying you should go sedate every animal so that they're totally gorked and they're not, they're not able to move. But giving them medication so that we can bring that anxiety level down a little bit and allow them to relax. And obviously, too, that also helps with responder safety, because if that animal is less stressed, they have a higher threshold for, I should say, if their anxiety is reduced, they have a higher threshold for that stress, less likely to react in a potentially aggressive manner. I think the one thing that is very important to point out is to remember that you need a veterinarian to be prescribing these medications. This is not something that you just go out and give to your responders and say, hey, if he looks a little stressed, go ahead, give some trazodone, give some gabapentin. So just need to make sure that everybody understands that as well, that these are still medications, and a veterinarian should be the one that's prescribing them. That's not to say that you can't take input from staff and responders, because again, like I mentioned before, we all know, particularly animal care that's out there dealing with the animals every day. They're the ones that often pick up on it and say, hey, so and so is just he's not been eating. He seems really stressed. Is there something else we can do for this guy? And then public health considerations. So just wanted to touch on this because, again, as the veterinarian or even just as medical staff in general, you are the one that really needs to think about human health as well. And you're probably going to be fielding questions from staff and responders if they have concerns about some of those, potential exposure or risk from some of those diseases. And just wanted to put up, a couple of examples. Obviously, this is not at all a totally inclusive list, but some potential zoonotic diseases that you might deal with in the shelter setting. And remember too that you need to know, think about the region that you're going to and what, if there are any regional variations. For example, I'm from Colorado, so plague is always on my list. But back here in the East Coast, I'm sure that rarely ever pops into anybody's head. But so think about things like that. Or obviously, too, if there are differences in between the species that you're dealing with and what those different risks might be. And then also, I put this in with safety more so it's a little bit more from an animal safety standpoint, but just thinking about potential infectious disease outbreak. Again, you're bringing animals and really potentially stressed animals into a shelter setting. You run the risk of, again, just like your typical shelter environment, you run the risk of infectious disease spreading really easily. So if you do notice something, I think first and foremost, just with like any emergency, just, stay calm, think about what's going on, and then just try and do the best for the most, essentially. So it's population medicine. So again, not that we're not treating individual animals, but we need to think about the population when we're making decisions. So essentially, you're just trying to contain and then mitigate. So if stopping animal movement, if you can, that might not be completely possible, but you can start segregating populations and having only dedicated personnel that are working in your isolation area, so they're not risking spreading that disease to the to your non-sick individuals, making sure that there's appropriate care in place, and then also to making euthanasia decisions if that is necessary. And then lastly, just want to touch on donations, and I know it might seem a little weird to put that in there with safety, but it can be a safety issue, and I'm thinking of that somewhat from a medical standpoint. You get during disasters, and I don't know if anyone has had to deal with this at their own shelter, but during disasters, or even if it's not a disaster, but there's some kind of big event going on, you get people just come out of the woodwork with donations, and usually it comes from really good intentions, and they're trying to help. But you guys know sometimes it can just be absolutely overwhelming. I know this picture is actually from the shelter I used to work with, and it obviously you guys don't have any perspective, so you don't don't know what this area looked like, but this was kind of a multi-purpose, essentially think of it as like a 2-car garage size area. And this was during one of the fires we dealt with. And within 24 hours, it was just filled with stuff. You know, dog food, leashes, litter, paper towels, everything you can think of. And like, we were literally overwhelmed. They actually had to go get, you know, a storage unit and put it up at the top of the hill. So we had some place to put all of this stuff. And, you know, and it's really hard to tell people, stop, don't bring us anything, because they just want to help. But be prepared for that, and realize that what you get may not be useful. I'm sure you see this in your shelters on a day-to-day basis with the donations you get. So ideally, if you can have you know, a volunteer responder that can dedicate a little bit of time to kind of going through that stuff as it comes in, and so that they can quickly weed out what's useful, what's not. And particularly when we're talking with, you know, medical supplies, make sure that they're checking expiration dates and, you know, again, like I said, make sure that it's something that you can use. And then if it is something you can use, keep it accessible, have a plan so that you can actually get to it and use what you've got coming in. So just to wrap up, you know, plan as much as you can in advance. It really is going to help. You'll feel more prepared when you start. Communicate with everybody, communicate with the different teams within your team so you know what's going on. And expect the unexpected. You never know what's going to happen. And this is just more of a fun little story than anything, but this background picture, when you talk about expect the unexpected, like I mentioned, the shelter I had been at, we responded to, there was flooding in Colorado several years ago. And in the middle of all this, we were primarily taking in animals from individuals that had been evacuated. And in the middle of this, we get a call, our animal control gets a call from National Guard that they found a few rabbits in a house when they were going door to door. Yeah, the few rabbits was 111 rabbits in about a 600 square foot house. So that was, fortunately, it all turned out great. The whole situation went really well, but it was one of those, you know, it was kind of a disaster within a disaster, something we weren't expecting, but you just kind of deal with it and go with the flow and, and do what you need to do. All right, well, thank you guys.